Hello, everyone. Welcome. My name is Kristen King with Advocates for Human Potential, and I'm happy to welcome you to our first Whiteboard Wednesday. Today, we're going to be chatting with my friend and colleague, Patrick Gauthier, about workforce development for ACOs. So I'm going to bring Patrick on the screen now and let him introduce himself. And while I pull him up, I'm happy to tell you that Patrick is the director of our Healthcare Solutions Division. So Patrick, I'm going to let you take it away.
All right. Thank you, Kristen. Thank you very, very much. And good afternoon, everybody. This is our inaugural Whiteboard Wednesday. We've been waiting to do this a long time, so thank you for joining us. And, I want to start with just a real brief story about a large integrated provider system in Western New York. We had the opportunity to work with them over the course of months and years. And they were really experiencing trouble on three fronts. The first was they were having a great deal of difficulty getting attention from payers and partners in the communities in which they worked. The second was that they had very high staff turnover. And thirdly, they had low clinician productivity, and they were really beginning to suss that out in terms of related revenue concerns. And as we went in and sort of diagnosed these issues, the question was, of course, are these unrelated problems? And the answer is no. These are really related problems, and I refer to them as the three facets of workforce development. They're all three different faces of the same problem. And that is a problem or a solution that is communication, whereby we can raise awareness and generate real positive visibility in the community, that we can attract partners, we can attract potential employees. In that sense, we become a magnet employer. The second problem or solution or dimension is that of people. And this is, I refer to this as a more traditional human resources, personnel set of strategies that focus on people, right? So this, of course, has to do with roles and career ladders, especially, and training programs that improve morale. The third dimension or facet is that of finances. And this is the idea that in a workforce development strategy, we can tie reimbursement and incentives to effective management of scope of practice and our clinical staff and our non-clinical staff, and that we can match productivity and performance to those incentives. The idea being that the more financially sound we are, the more sustainable we are, the better we can perform as an employer and take care of our people. So let's take a look at these each one by one, starting with effective communication and being rather magnetic in the community. And I like to remind people that, look, we're always competing with other employers in the community for the best talent. I think we all know that. And we might, in fact, be competing with other career paths for some people. The culture that we create and perpetuate, the environment that we create, is something that is going to wind up being communicated to the people that we hope to recruit, and it's going to find them before we do. So we want to make sure that we're doing everything we can to manage what we communicate and manage the culture that we're creating. For example, if we have a toxic or a hostile work environment or culture, we're definitely going to suffer the consequences when we attempt to recruit people, especially the best people. If, on the other hand, we have a reputation for growing talent, for inclusivity, for celebrating diversity and nurturing the careers of our teammates, it's that ethos, it's that reputation that's going to serve us very well. It's going to reach into the community and attract people. Next slide, please, Kristen. I want to talk about those traditional workforce development strategies just a little bit here. And that is, we begin always with real clearly defined roles, job descriptions, and expectations or performance standards. That's a must. However, However, where we tend to fall short in some circles is with respect to the career ladder. That career ladder, my ability to climb within the ranks of the organization, has to be evident, and it has to be attractive or compelling. If I can't see it, if I ask you about it and you can't tell me about it adequately, why then that's going to begin to answer a nagging question in my mind as a candidate, which is there an opportunity for growth personally and professionally, or is there not? And if there isn't an opportunity for growth, especially for people coming in lower in the organizational structure, that's going to be a real turnoff, let's face it. But when people can see an opportunity for growth, that career ladder, it's staring them right in the face. It's motivating them, it's compelling them, they're going to stay and grow. We know that. The other thing I want to say about human resource personnel and traditional workforce development strategies that should be really abundantly clear to everybody today is that we are in a state of change, an era of reform. We're living through unparalleled innovations in technology, for example, in healthcare, this era of big data and interfacing with software and business and intelligence and predictive modeling. We've just never seen anything quite like it. And I think it's incumbent upon healthcare organizations as employers to make sure that their training plan is going to keep pace with the rate of change in the world today. And if it isn't, our employees are going to see that they're not keeping pace with their peers, perhaps working someplace else. So it's going to be just critically important moving forward, especially as people begin to come back to work from perhaps having been furloughed or laid off entirely during this pandemic. As they come back to work, they're going to be looking for that growth potential, and they want to know that they're growing into the cutting edge. So very important for us to keep an eye on that. Kristen, we'll go to the next slide now and talk about revenue and the financial dimension of workforce development. And bottom line is the bottom line has to be healthy. I like to remind people that, look, you have a choice as it relates to workforce development and your bottom line. You can be in a doom loop, which I'll talk about momentarily, or you can be working to climb a spiral staircase to success. That's a choice that we have. And it begins by understanding that our workforce, all of them, at whatever level they happen to be working, should be working to the uppermost of their scope of practice. In other words, and I think this is a pretty common example, I don't want to burden physicians, nurse practitioners, psychologists, for example, with administrative support duties. They should be working at the top of their scope of practice. All right, that's going to help me avoid burnout, which can lead to a doom loop. If people are doing too much, trying to keep up with administrative tasks when they should be taking care of clinical tasks. But it's also going to raise my costs of doing business. So the longer my professional staff is spending on non-professional activities, the more my costs are going up. And at some point, those costs are going to exceed the rate of reimbursement. And it's our job to keep costs down. And one of the ways that we can do that is by leveraging our technology and leveraging administrative support staff. Then I can keep expectations about billable time or productivity among clinicians really clear and reasonable, because the alternative to having people do too much administrative work is expecting them to do too much clinical work. And one way or the other, I'm going to burn my professional staff out. So I've got to be very reasonable. And I think the best path forward is to, number one, look at your business plan and get your key performance indicators from your business plan. Factor in your quality of care aspirations and goals, and find a balance between the financial and the quality of care. and then set specific standards for billable time, for um, quality, and measure, monitor, and report your findings. Be transparent. This is an era of great transparency. That data should be made available to people, and in all fairness, then you can hold them accountable for their productivity. These kinds of things all contribute to this spiral staircase to success that is going to make your organization, your healthcare, your behavioral healthcare, your social services organization financially healthy, which allows you then to take care of your people and particularly to deliver really high quality care. Okay, so we've discussed your reputation in the community, that you need to communicate that and be a magnet employer, a magnet partner, a magnet provider to the payers. We've talked about having a very compelling career ladder and robust training. And we've talked about having a very high financial performance so that your programs can all be sustainable. If I'm not mistaken, Kristen, we've got a link to the white paper that we produced on this topic, and I want to encourage you to please download the white paper. And please visit our website, www.ahpnet.com, where you'll find a lot of resources for ACOs, a lot of resources as it relates to workforce development. The third thing I want to do is encourage you to give us a call. Our telephone number is on that material, and we'd love to talk to you about how it is that we might help you with your workforce development challenges. And before I sign off, and first of all, thank you for your time, but I want to circle back around to that employer in that integrated delivery system in Western New York that I started talking about. You know, today they are a partner to many more healthcare, social service, managed care organizations. So that was a success. Their turnover is much more average today than it was before, when it was much higher than average, and that's a tremendous success. They're holding on to people, valuable people, a lot longer. Employee morale is up, and thirdly, they're performing in terms of financial performance at a much higher level, and that's good for the bottom line. It's good for the patient. It's good for the employee. The whole community wins. So with that, I'm going to stop there, turn it back over to Kristen, and see if we have any questions.
Hi, Patrick. I am back. And yes, we do have a couple questions. I received some privately, so I'm going to read those aloud. And then for the other folks who are watching, if you have a question, go ahead and type that in the comments, and we'll be happy to discuss that with the time that we have left today. So the first question, Patrick, is what can we do about our high rate of turnover?
Oh boy, that's a real common question, number one. And I think, first of all, we have to stand back from the pandemic era that we're in, because I know for a lot of primary care practices, for example, a lot of clinics, they've had to let people go. They've really been decimated. That's beginning to build back up. But we need to account for this very strange time, difficult time that we're in. Second, I would say, is that we need to understand just what we mean by high turnover. Is it in fact higher compared to what? What are we comparing to? And it's important to do a little bit of research to discover what is in our sector, our particular sector or niche, what is the rate of turnover on average? And if we're at 20%, 15%, 25%, are we higher or lower than the average? That's going to be very important. Otherwise, you could be putting a lot of effort into something that might be less of a problem than you believe it is. The other is to understand turnover is a function of all three of these different facets that we've been talking about. I think that there are some intrinsic things that make up our culture, right? And so to the degree that I feel like my sense of purpose or mission is being fulfilled, to the degree that I'm being recognized as a person for the work that I'm doing, and being recognized as a whole person, and the culture, the broader culture than beyond me, my sense of teamwork and the morale in my organization, those are the kinds of things that can lead to turnover. They can also help reduce turnover. The other is that a lack of opportunity for growth, and we talked about this with respect to sort of the traditional HR dimension of this work. If I can't see a way up, I'm going to start looking for a way out. Okay, and so if as an employer I'm not making those opportunities available, I'm going to have to deal with the consequences of that. And the third is if compensation doesn't change over the course of time, if our financial performance as an agency is not good, and we can't offer people cost of living increases, let alone a raise, a real material bump in pay, then at some point people are going to start looking elsewhere. So that can contribute. So for people who believe, and maybe they're right in believing that they have a high rate of turnover, you have to address the problem on all three fronts. Culturally, from a human resources standpoint with your career ladder and your training, and then from a standpoint of financial performance. And doing, for example, compensation studies in your area. Are we in fact underpaying or are we about average? We need to know the answers to these questions before we act.
Yeah, I really appreciate, Patrick. One of the things that I love about you is that you are very focused on using data to support decisions, but not to the exclusion of actually having conversations with people and finding out what really matters to them, because these are human resources. And so that balance of the numbers and the comparisons alongside, what is the experience like in that cultural piece is so important. That's so important. So thank you for highlighting that. We've got another question here. And this might be a two-parter actually, because there may be a follow-up here. So here's the question. How can we train our folks in the middle of a pandemic? In 30 seconds or less. Just
2 words: virtual training. It is extraordinarily difficult, and we're working with ACOs right now in various parts of the country that are tackling this problem because they have a very steep learning curve at a time when it's difficult to bring people together. And what we've done at AHP is we've invested in building our virtual solutions to ACOs and other healthcare providers and behavioral health and social service providers that allows us to reach into the organization with top-notch curriculum, having been developed to meet real strategic goals around, for example, with ACOs, care coordination, particularly care coordination as it relates to serious mental illness or social determinants of health. And then packaging all of that training and delivering it over remote or virtual platforms is all the rage today. We've seen in the last 6 months platforms like Zoom just take off into the stratosphere, and there are many others, including the platform we're on today, that allow people to access training and top drawer training, but to do it all virtually. And there's some real advantages to doing that. And I think that's why, like telehealth, for example, in a clinical dimension, I think a lot of this virtual training is here to stay.
Thanks, Patrick. And as the virtual learning person at AHP, I totally agree with you. So, I mentioned that question might have a second part, and I think the second part goes back to the answer to the first question. So, we were talking about how do we stem this turnover, and how do we give our staff more of what they need amid the limitations that may come with the pandemic. I think the virtual training piece that you talked about and virtual opportunities for connection are part of that. But if we're in a difficult financial situation because of the things that are happening around us, like what are some other things that we can do to stay competitive and to help folks feel like they are valued and that they are getting as much value from the arrangement as they're giving?
Boy, that's a kind of a big question. And I think, I go back to these 3 dimensions. I think there are a lot of these things that we can do, particularly at the level of culture and what we're communicating one-on-one to one another, and and what we're communicating throughout the organization. And I don't know that I need to remind anybody, this is an era of also, pandemic, but health equity. And I think in that health equity is recognizing the wholeness and the fullness and the richness of every person, whether that person is a patient or a colleague. And and of course, times are tight for a lot of organizations right now. A lot of hospitals are real tight. I mentioned the primary care clinics are real tight right now. So spending money is not something that's going to make a lot of sense in the short term. Longer term, yes, but in the short term, what can we do to improve morale by bringing people together and recognizing, again, the richness and fullness of the people that are on our team, and recognizing their achievements, their hard work. Recognition is something every human being needs. And I think we know enough today that, we can take care of paychecks and making sure you have a competitive salary. But on a day-to-day basis, I have to recognize you, and I got to recognize my patient as just a wonderful and rich human being. And I think that's probably the place of greatest emphasis for improving morale, and improving the mood of folks at work and giving them a sense of belonging. Now, are there other things that we can do to put information in front of people so they feel like they get to grow while their morale is high? I'm a big believer in yes, but it does require time to we need to have some conversations. Do we agree that we're going to pay people to invest the time to read, to study, and to take in what is at the cutting edge of healthcare and social determinants of health and population health today? That's a very big, broad, cutting edge. There's a lot happening there. People are hungry for the information, but as employers, we need to make a commitment to getting them the information, whether it's in a virtual training platform or in a book. The bookstore and getting some books and making them available to people so they can read at the cutting edge is a simple thing to do.
Yeah, thank you. So Patrick, we're running low on time. I don't see any new questions coming, so we're going to move toward wrapping up here. I'm going to pull up that white paper again, and let me move this screen around here a little bit. All right, so we've got this white paper available. The link is in the comments. I would invite everyone to go ahead and download that. Sorry about that, Patrick. I dropped my audio for a second. Can you tell folks a little bit about what they can expect from this white paper?
Well, I'll tell you what they can expect is more of what we've been talking about. That at AHP, we've been in the workforce development arena for about 35 years, and we all come with great depth of experience and expertise and come at this. And we've made a real strategic decision over the course of time to come at workforce development from these three angles, accounting for all three dimensions. And I really want to encourage you to download this paper, because there may be one of these dimensions that was not on your radar screen, one that wasn't in your consciousness. And you may find yourself reading and agreeing that, wait a second, how we communicate who we are in the community has a great deal of influence in our workforce development. How we manage ourselves financially, how we're performing, our level of productivity, how we hold people accountable. These things all contribute to workforce development. So it's going to be more of what it is that we've been talking about at greater depth.
Awesome. Patrick, thank you so much. This was a blast. I always love when we get to do stuff like this together. So folks, thanks so much for joining us. We will keep an eye on the comments. So if you are watching this in replay and you have some questions and you'd like to hear from Patrick, please go ahead and leave a comment and we will get back with you, and do take advantage of that white paper. Thanks everyone. Have a great Wednesday and a great rest of your week. We will see you next time for Whiteboard Wednesday. Bye now.
Bye now.